Okay, I'm going to bring everyone in.
Okay.
Hello, everyone. We're just going to give it one more minute and then we'll go ahead and get started. All right, everyone, we're going to get started in just a minute. I am hearing some background feedback, so if you could please mute yourself unless you're speaking, that would be super helpful. Okay, so good afternoon, everyone. My name is Kira Acuna, and I'm presenting today on Adult Day Services, specifically on the new dementia training requirements. This is our second and final stakeholder meeting that we will be hosting on this topic. So with that, let's go ahead and get started.
Amber just sent an email and said, well, it might.
I'm just gonna go ahead and mute all. So I just went ahead and muted everyone. Of course, if you do have a question, feel free to unmute yourself at any time and speak up. The department's mission is improving healthcare equity and access and outcomes for people we serve while saving Coloradans money on healthcare and driving value for Colorado. The purpose of today's meeting is to engage stakeholders on the new dementia training requirements under Adult Day Services. As a reminder, the dementia training requirements also impacts assisted living residences and nursing facilities, although CDPHE is responsible for implementing those requirements, impacting those two providers types. Therefore, again, today we'll only specifically be discussing adult day services and how these requirements impact that provider type. Then we will respond to questions about the draft regulation changes implementing the dementia training requirement under adult day services. So during our first meeting hosted on March 8th, we went through the draft regulations line by line. There were very few comments or edits to be made. Therefore, the majority of today's meeting is instead going to be focused on some of the questions that came up during our last stakeholder meeting. However, I'm happy to go over some of the draft regulations as well if needed. Our agenda today, kind of similar start to last meeting, we're going to review Senate Bill 22-079. We're then going to clarify services and waivers impacted under Senate Bill 22-079. For those that are not familiar or were not a part of the meeting last time, this is the bill that implemented the dementia training requirements. And I believe Meg can put a copy of that bill in the chat for you all to look at. I'll also ask, if Meg has not done so, for her to put a copy of the slides and then also a copy of the draft regulations. Again, after we clarify services and waivers impacted, we'll highlight the main points of Senate Bill 22-079. We will then review the timeline for implementation, debrief on our last meeting, respond to those big questions that came up during our last meeting, receive any final stakeholder meeting, and then determine next steps. So Senate Bill 22-079. So in May of 2022, the Senate Bill was signed into Colorado law. This is requiring dementia training for direct care staff of specified facilities that provide services to clients living with dementia. So by 2024, rules must be adopted requiring these covered facilities to provide dementia training for direct care staff members. Adult day care services specifically were included on the list of specified facilities, as it is estimated that about 31% of individuals using adult daycare services have dementia. And CDPHE is required to implement similar regulations for assisted living residences and nursing care facilities. CDPHE already has completed their stakeholder meeting process and have drafted their regulations implementing these training requirements for assisted living residences and nursing care facilities. So to reiterate what I stated in last meeting, the regulations for adult day services very closely mirror what CDPHE drafted for their two settings. And this was done specifically for consistency purposes for training across all providers. So with that, this was a really big question that came up during our last meeting. So the next 3 slides are going to specifically address which services and waivers the dementia training requirements impact. And so it applies to adult day services, which serves members on the following waivers: elderly, blind, and disabled, or EBD, community mental health supports, or CMHS, brain injury, or BI, complementary and integrative health, or CIH. At this time, it does not apply to day habilitation services, which includes specialized habilitation and supported community connection services. And day hab services serves members on the developmental disabilities waiver and supported living services, or SOS waiver. So Senate Bill 22-079 repeatedly referenced adult daycare facility as a term used interchangeably. And this is a term that is used interchangeably with adult day services specifically. So there I kind of took a copy and paste from the Senate bill specifically. And as you can see, it does reference adult daycare facility. Similarly, the bill also applied to assisted living residences, of which only members on the EBD, CMHS, CIH, and BI waivers are served. And finally, supported community connections under day hab services does not necessarily have a physical location or facility. So while the intention of the bill may have been training requirements to apply to all people who work with someone with dementia, which of course could include those in the IDD aging community, the wording of the bill really only applies to adult daycare facilities, which is therefore adult day services. However, so at this time, the department is pursuing implementing these requirements for adult day services providers only. Again, this is as required by the Senate bill. However, in the future, the department will look into implementing similar dementia training requirements for DD and SLS providers as well, which will include both day hab services and residential habilitation services and supports providers. So not just the day side of things, but also implementing it for residential providers. So this will include host homes, family caregivers, and group home settings. So the department recognizes that this is a very valuable training and it should apply to all waivers. So while the legislation did not address all settings and waivers at this time, the department will look into implementing it, again, both for day hab and residential settings in the near future. That process will just be completed outside of the current adult day services implementation process. And so with that, I just want to pause for a second because this was a really big question that came up during last meeting. So I just want to pause and see if there are any final questions over which services and waivers these requirements apply to, or anything as far as that before we continue on. Any questions? And again, feel free to unmute yourself if you would like to provide a verbal comment or question.
Do you have any idea, like when you say in the future that'll be something looked at for DD and SLS waivers, do you have a remote timeline for that?
That's a really good question. I don't have that. I know just kind of in general, we're looking at a bigger just weight or like regulation change in general. So I don't know if we would want to maybe include this additional requirement in that big change, or if we would want that process to I guess be finalized and then try to implement this. But I could see that we would definitely want to pursue this, I would think, by 2024 at the very latest. But that's a really good question.
Okay, thanks.
Yep. Any other questions before we continue on? Again, I know this is a very important topic.
Hero, we will need to send out the draft at a later time. The draft link is now requiring access and permission.
Okay. Perhaps at one moment in time I can update that. I thought I had, so I apologize for that not working. If it doesn't work by the end of the presentation, then we can definitely email it out to all participants. So thank you for letting us know. With that, I'm going to take that as a sign that maybe there are no further questions or comments about this. So we'll continue on. So Senate Bill 22-079 in adult day services. So again, this is just a list of what the department is required to include in these rules. So if you have any questions or concerns about how any of these bullet points are addressed with the draft regulations, please do not hesitate to ask. So at a minimum, the rules must specify the date in which the new requirement is effective, the length and frequency of the training as specified in the bill, the content of the initial dementia training, which must include or must be culturally competent and include the following topics. Again, these were outlined in the bill. So dementia diseases and related disabilities, person-centered care, care planning, activities of daily living, and dementia-related behaviors and communication. It must also include method for demonstrating completion of the required training and continuing education, and of exempting a direct care staff member from the training, an exemption to the initial training requirements, minimum requirements for individuals conducting the training, a process for the State Department to verify compliance, and any others matters that the state board deems necessary. So this is our implementation timeline. Again, we went over this during the last meeting. So completing stakeholder feedback, that's being done in March of 2023. Again, this is the second of 2 meetings that we are hosting. I then plan on presenting to the Medical Services Board in May and June of this year, with a plan for these rules being effective in either August or September of 2023. And then the regulations having an effective date as stated within the draft regulations of March 1 of 2023. Senate bill compliance deadline specifically for adult day services is July 1 of 2024. Please know that differs a little bit from assisted living residences and nursing facilities, which has a January 1, 2024 deadline. Again, we kind of touched on it, but during our last meeting on March 8th, we reviewed again similar background information. So we went over the Senate bill, implementation timelines, and the main points. We then reviewed draft regulations to implement the training for adult day service providers. We really went over this line by line. Again, kind of the main point was that it has an October 1 of 2023 implementation date. During that meeting, I did not receive any concerns or feedback over the draft regulations themselves. There were some questions that were raised, which will be responded to on the next few slides. And just so everyone knows, the March 8th meeting was recorded, and that recording is on our website that I'm hoping Meg will post a link in the chat to. It also has a copy of the slides for you to review. Again, there were no changes to the proposed regulations as a result of that meeting. There were 2 tiny little typos that I did point out. And so again, I don't plan on going over the draft regulations because we did that last time. However, if stakeholders, would like to go over that, I'm happy to do that. I just was not planning on it. So I'll let you all decide. So the next few slides are two of the other main questions that came up during our March 8th meeting. So where can providers look for this training? And a similar question was if providers need to develop their own curriculum, which they do not. And so instead, providers can simply Google various dementia trainings and find the one that's best for your setting. The training does not need to be completed in person. Online is perfectly acceptable. And so this is just a short list of training entities that you may be familiar with already. There's the Alzheimer's Association, and they actually have a list of recognized dementia care training programs. I'm hoping Meg is going to drop that link that's on your screen in the chat. So included trainings that they have on their list are Allsbetter, Care Academy, EduCare, Healthcare Academy, and many others. There's also the training Relias, which I know many of you might be familiar with, and then Healthcare Interactive as well. Again, this is not an exhaustive list. This is just, some of the top ones that we are aware of. The department is also aware that there may be some local provider agencies who are offering related trainings courses. Some of them may even be free of charge. So again, providers are really encouraged to find a training that best meets the needs of the members in which you serve. Before we kind of jump on into the next question from last meeting, were there any further questions over where providers can look for the training? All right, seeing no questions. Moving on to training requirements. And so this final question was about whether continuing education units needed for specific certifications could count if the training is dementia specific. And I believe it was Michelle that raised this question. So I did speak with CDPHE about this, who agreed with the following response, and that is that as long as the training is done by an individual that meets these qualifications, then yes, that training would count. So again, within the draft regulations, the minimum requirements for individuals conducting dementia training include specialized training from recognized experts, agencies, or academic institutions in dementia disease, similar or successful completion of the training being offered, or other similar initial training which meets the minimum standards described herein, and 2 or more years of experience in working with persons living with dementia diseases and related disabilities. So again, therefore, as long as the trainer's experience meet these requirements, then continuing education units needed for various other certifications would count towards meeting one's initial training or continuing education training requirements, as long as that training that is being taken is dementia specific. Any further questions about this topic in particular? Okay, fantastic. So then I'm just going to go over the minor draft regulation changes. And again, I'm gonna jump over also and make sure that you guys are able to access the draft regulations. There were 2 minor grammar changes that were corrected from last meeting. I believe one of those was the word late was supposed to be later, and another one was like diseased was supposed to be diseases. So I made those 2 small changes, and then there was one change that came out of my conversation with CDPHE, and it was under the documentation requirements. Previously, it had specifically said that the provider shall maintain documentation for the completion of initial dementia training and continuing education, and such records should be available for inspection by a representative of the Colorado Department of Public Health and Environment. They recommended that we change that to just available upon request. And so this provides the opportunity for both departments to request this documentation if needed. So that wording change has been made in the draft regulations that apparently you are not able to access right now, but you're getting access to very soon. But that was literally the only change that was made from last meeting. And again, that came as a recommendation from our partners over at CDPHE. Any questions on that change or any of the changes? Okay. So with that, I'm going to open this up to you all. Are there any further questions or concerns about the draft regulations or the implementation of these regulations? Would you like me to go over any parts of the draft regulations in more detail? I'm just going to take it a moment now to open it up for other people to speak or ask questions, and I'm going to try and get you all access to this document.
Kira, there is a question. How
Okay.
long will the training be valid for?
So again, there's continuing education requirements every 2 years, I believe. And so every 2 years you would have to be retrained per what the regulations state. Does that answer your question? If
Yes, it
not,
does.
okay,
It does.
fantastic. Okay. Let me see if this link works. Can somebody just, hopefully that link works.
That's accessible.
Okay. So there, I apologize for the delay, everyone. That is the link to the most recently updated draft regulations. Again, that should include this change that I went over on the last slide. That includes the upon request versus just a CDPHE. I apologize for the delay on that one. What other questions or concerns? Again, would you guys like me to go over any of the draft regulations? Otherwise, I feel kind of bad wrapping up really quickly. So I just want to make sure that we're covering any final questions or concerns that anyone may have.
Am I remembering right that the legislation requires the training be 4 hours?
Yes, so the initial training is 4 hours, and then I believe it is 2 hours every 2 years ongoing.
Cool. Thank you for that clarification.
Yeah, absolutely. Any other questions? Feel free to speak up, raise your hand, or drop anything in the chat, but just know that while today is the final stakeholder meeting that we are hosting on this topic, feel free to always submit additional questions or feedback to our email address, which is hicpuff_hcbs_questions@state.co.us. Again, these new rules are going to be presented to the Medical Services Board in the coming months. And then it's going to have that effective date of October 1 of 2023. I stated this during last meeting, but please know that you don't have to wait until October 1 to begin training your staff. You can absolutely begin training now if you would like. That's up to your discretion. And with that, I mean, any final questions before we jump off?
So I'd just like to address Michelle King's comment. Some of the online trainings are 3 hours only, so you will need to check the hours before you commit to them. I have started looking into them. I will also let you know if you use Relias as a training platform, there are several trainings within Relias that meet the time requirements or can be added together to meet those requirements. And the other link or other resource that Kira had put in as far as the healthcare resource, that they have had some really great resources for these types of trainings.
Great, thank you, Meg. Any final questions or concerns? Again, if something pops up in the coming days or weeks, feel free to email us again at HCBS_questions. But if there is nothing else, then I'm gonna give you guys back, I guess, almost an hour of your time. I think we were supposed to go until 2:30. So thank you all so much. Yes, so I
I'll
believe,
be sharing those slides right now. It will also be available on our website for recording.
yes, so all of our honestly day program stakeholder meetings have been recorded and they're on the department's website. And so you can always access this, any of those slide decks, any of those recordings, those are always available, but I believe you should now have the slides as well. So thank you, Meg. Any final questions? All right, well, with that, thank you all. I really appreciate your time and your questions and your comments.